During some of our conversations, we've covered what symptoms to be aware of that might give you an idea things are a little off, that they may be characteristics of pending issues related to dementia or possibly Alzheimer's. And we've talked about some of those behaviors, some of those actions that are yellow flags, cautionary flags to you. Well, once you've assessed that and you've had a conversation with the doctors, it's time to really delve into what are the types of tests that could be taken to help you determine exactly what is the problem or narrow things down. Right now, I'd like to chat with you about some of the more traditional tests that are used so that you're familiar before you walk into the doctor's office with what you want them to offer you. And if those conversations and if that test doesn't come up in conversation, I want you to be comfortable and informed to ask them about them. The most common test for evaluating short-term memory, language ability, and attention span is what we call the mini mental assessment test. It's approximately 10 to 20 minutes long, and it will include some questions such as, do you know what day of the week it is? Do you know what year this is? Do you know where you live? Do you know who the president is? It will usually involve giving them 3 to 5 words that the doctor wants you or your loved one to remember, and they're going to come back to that a little bit later and have a recall session. And most often will involve what we call the clock test. And I have a photograph of that to show you some examples of the clock test as it's been completed by a number of different people. The whole idea here is to have someone understand the physicality of what a clock looks like, what it should look like, and then they're going to be asked to put the numbers in, and then they're going to be asked, can you put the hands in to tell me that it's 10 minutes to 2 or 3:15, okay? By doing that, that tells the doctor a great deal about cognitive impairment, symmetry, spatial relationships, and so forth. Really crucial. But this is a mini mental exam. There's going to be a score with this exam, and it might be anywhere from, well, let's hope it's at least in the 20s. If it starts dropping down into the teens, it's evidence that there's a real decline in awareness, understanding, and you plan accordingly. This is usually done as a baseline so that you have a place to start. So that's the mini mental test. There's another test that was introduced recently or in the last few years, and it's been approved by Medicare, and it's called the mini cog, the mini cognition test. And I'm very proud to say that I know well the doctor that designed and developed this and had it approved for use in the medical field. That is Dr. Sue Borson. And a little bit later, we're going to have a conversation with Dr. Borson to talk about why this particular test is so effective. And as I said, it's a 3-minute instrument, and it's used to screen impairment in older adults in a primary care setting. There's going to be a 3-word registration. They're going to give you the 3 words. They're going to introduce the clock drawing, and then there's going to be a 3-word recall. And again, in that simple time frame, it's going to give the doctors a very great clarity on how to evaluate where somebody is on a baseline. Taking it to another step, I'm also going to introduce you to an exceptional neuropsychologist, and that's Dr. Balaji Natimi. A neuropsychologist can be very, very important in your assessment strategy. They're going to be able to do a study, and usually it's a 3 to 4 hour period. It's conducted sometimes over 2 days, and it involves a wide range of activities. There are Q&As, there's tactile activities, there's motion, mobility, and so forth. And what's especially valuable about the neuropsychological exam is that it's the one that's most sensitive indicator to Alzheimer's and other types of dementia. What the neuropsychological examination will allow the doctors to do is determine what is the overarching issue that's causing the problems that the person seems to be having, and what are the secondary and possibly third or fourth level of issues. It's not unusual to have people experiencing cognitive behavior issues, balance issues, because of more than one reason. So the advantage of working with a neuropsychologist and having this battery of tests is really exceptional in pinpointing what the overall elements are. I shouldn't say overall, I should say the specific various elements are that are making up the condition someone's living with right now. Now we have what are called scans, things that you're familiar with and are used for a variety of other reasons, an MRI, a CAT scan, or a PET scan. So these generate a photographic image of the brain, and it identifies the changes in the health of the brain. An MRI is extremely valuable for a baseline of the brain's health. It's going to show the radiologist a way to judge, to score the health of that brain. What parts of the brain possibly are not looking as healthy, parts of the brain that have really shrunk. One of our earlier conversations, we talked about the parts of the brain. Well, the beauty and that within the parts of our brain, every section plays an important role in how we think, remember, walk, smell, taste, hear. So that MRI is your baseline for what parts of the brain might or might not be doing so well. Now, if you combine that MRI with the results of the neuropsychological battery of tests, they're almost always going to be spot on a match. And now you have a very clear definition of the issue someone is living with. And now you can move forward on how to treat it. Let me tell you about another segment that can be applied to an MRI, and that's called a neuroquant, Q-U-A-N-T, neuroquant. This is an additional medical imaging aid for early detection of Alzheimer's. It's going to produce two particular reports, age-related atrophy and general morphometry. That's not an easy thing to say, so it's not an easy thing to hear. Let me say it again, general morphometry. And it's going to tell you where the brain is morphing, the scale of where things are changing. And it's color-coded to segments of the brain. That can be very, very helpful. And again, as I mentioned, that's especially valuable for assessing or determining that early stages of Alzheimer's. That neuroquant is not available at every MRI imaging center, so you do need to ask about it. And these are things that are usually covered by Medicare or in your insurance as well. As I mentioned, I want you to have some real understanding about these different tests and why they're so beneficial, how they work, and the next step that having the results will help you with. So I've invited Dr. Sue Borson to have a conversation with us. She developed this testing protocol called the Mini-Cog, and she's going to share with you the benefits of this highly regarded, very effective testing. So let me also tell you that Dr. Sue Borson is Professor Emerita of Psychiatry and Behavioral Sciences at the University of Washington, where she was the founding director of the Memory Disorder Program for their University Medical Center. I'd like to introduce you to a terrific doctor, Balaji Natimi. He's a neuropsychologist. A neuropsychologist is someone who specializes in memory and cognitive function, and Dr. Natimi is going to elaborate about the significant benefits of including neuropsych testing in investigating what's behind changes in behavior, characteristics, and perhaps declining memory. So, Dr. Natimi, welcome. Now you have the information about the different kinds of tests that are available to you so that you can be a strong, informed advocate when you go to the doctors. And you have to be a strong advocate. I want you to ask for comprehensive testing. I want you to determine what's really the underlying issues causing all these changes that you or your loved one are having. You know, in my discussion earlier about just what is dementia, I emphasized there are quite a number of reasons for behavior changes and memory fog, as we call it. So pushing for all the testing possible for conclusive diagnosis is your right. It is absolutely right for you to have all that information. You want to know exactly what you're dealing with, what they're dealing with, so you're treating it properly and that you're providing the appropriate level of care for that individual. Well, we've covered a lot of ground in this particular conversation. We've had a lot of conversations with Dr. Borson and Dr. Natimi as well. I hope you're finding this of value, that this information is building a nice base for you so you can be a really effective, secure family caregiver.